Welcome to Health Tech with another video about lifestyle factors causing breast cancer. Breast cancer is a complex disease, and its exact cause is not fully understood. However, researchers have identified several factors that can contribute to the development of breast cancer. Here are some of the known risk factors. Age. The risk of breast cancer increases with age. The majority of breast cancer cases occur in women over the age of 50. Gender. Breast cancer is much more common in women compared to men. Although men can develop breast cancer, it is rare. Family history and genetics. Having a close relative, such as a mother, sister, or daughter, who has had breast cancer increases your risk. In some cases, specific gene mutations, such as BRCA1 and BRCA2, can be inherited and significantly raise the risk of developing breast and ovarian cancers. Personal history of breast conditions. Certain benign breast conditions, such as atypical hyperplasia or lobular carcinoma in situ, can slightly increase the risk of developing breast cancer. Hormonal factors. Prolonged exposure to estrogen and progesterone hormones, such as starting menstruation at an early age, before 12, or entering menopause at a late age, after 55, can increase the risk of breast cancer. Additionally, women who have never been pregnant or had their first pregnancy after the age of 30 have a slightly higher risk. Lifestyle factors. Certain lifestyle choices and habits can impact breast cancer risk. These include excessive alcohol consumption, smoking, being overweight or obese, and leading a sedentary lifestyle with little physical activity. Radiation exposure. Previous radiation treatment to the chest area, especially during childhood or adolescence, increases the risk of developing breast cancer later in life. Alcohol consumption. Studies have consistently shown that higher alcohol consumption is associated with an increased risk of breast cancer. The risk appears to increase with the amount of alcohol consumed. It is generally recommended that women limit their alcohol intake to moderate levels or avoid it altogether. Obesity and overweight. Being overweight or obese, especially after menopause, has been linked to an increased risk of breast cancer. Adipose tissue produces estrogen, and higher levels of estrogen in the body can increase the risk of breast cancer. Maintaining a healthy weight through a balanced diet and regular physical activity is beneficial for reducing the risk. Physical inactivity. Lack of regular physical activity has been associated with a higher risk of breast cancer. Engaging in moderate intensity exercise, such as brisk walking or cycling, for at least 150 minutes per week can help reduce the risk. Hormone replacement therapy, HRT. Long-term use of combined hormone replacement therapy, which includes both estrogen and progestin, has been associated with an increased risk of breast cancer. It is recommended to discuss the potential risks and benefits of hormone replacement therapy with a healthcare provider. Smoking. Although the link between smoking and breast cancer is not as well established as with other cancers, some studies suggest that long-term smoking may increase the risk of developing breast cancer, particularly in premenopausal women. Quitting smoking has numerous health benefits and is advisable for overall well-being. Diet. A healthy diet plays a role in reducing the risk of various diseases, including breast cancer. Some evidence suggests that a diet rich in fruits, vegetables, whole grains, and lean proteins may help reduce the risk of breast cancer. On the other hand, a diet high in processed foods, saturated fats, and added sugars may contribute to a higher risk. It is important to note that having one or more of these risk factors does not necessarily mean that an individual will develop breast cancer. Many people diagnosed with breast cancer have no known risk factors, while others with several risk factors may never develop the disease. Regular breast self-exams, clinical breast exams, and mammograms are crucial for early detection and better outcomes. If you have concerns about breast cancer, it is recommended to consult with a healthcare professional. Thanks for watching. For more videos like, share and subscribe to Health Tech.